Me say master, him going to the hospital. And me left. 3 days. Later, guess what?
What happened?
Him have diarrhea.
What you say?
Him have diarrhea.
You too lie. And vomiting too?
Yes.
What the nurse them say?
Guess what?
What happened?
Them say him have an infection.
What kind?
Have an infection.
See the style?
That same one. And guess how him get it?
Who?
We go read about it. Him getting at the hospital.
You too lie.
In at the hospital. And guess how?
How?
By the nurse them.
And the doctor too?
That a true.
Them no wash them hand.
That a true.
Them you wash them hand. Washing your hand and if you washing your hand. Oh no, what's the number washing your hand?
A brief introduction on our topic. In a healthcare setting, certain procedures and guidelines are essential, and the implementation of hand hygiene is one such requirement. Hand hygiene involves general hand washing with the use of soap and water and the use of antiseptic agents such as antiseptic hand rubs or antiseptic hand wash. According to the World Health Organization, a hospital-acquired infection is an infection acquired in the hospital by a patient who was admitted for a reason other than that infection. It has been noted that both antiseptic hand washing and alcohol sanitizers contribute to the reduction of nosocomial infection during hospitalization. However, some studies concluded that alcohol hand rubs are more effective in reducing bacterial contamination during patient care routine compared to antiseptic hand washing. Another study suggests that antiseptic hand washing is more effective at removing the C. difficile bacteria that result in a nosocomial infection. And you know that a C. difficile bacteria, this is transmitted by a fecal oral route. So if the nurse come in contact with the feces, this organism is normally found in the gut. So if the nurse come in contact with the feces and proper hand hygiene is not performed and the nurse go along and touch another patient, contaminate the patient, this is how the organism is spread, and that patient contracted the organism in the hospital, so that's why it's a hospital-acquired infection. Thank you.
Hi. Study 1. This was conducted at a university hospital in France. It used 3 intensive care units, where they chose 23 participants. Now, of these 23 participants, 12 were assigned to use a hand rubbing agent with a waterless alcohol-based solution. 11 were assigned to use antiseptic hand soap. Now, before the study had begun, the participants were already briefed on the correct way to use alcohol-based solutions. Each ICU had copies of policies implemented by the hospital to explain this. The study zeroed in on the effectiveness of antiseptic hand washing over hand rubbing with a sanitizer. Now, this article was helpful in formulating a generalized conclusion. The results of the study were formulated by testing the participants' hand after hand hygiene with any products that was tested. The researcher did this by taking an imprint of the fingerprints and palms of the participant's dominant hand 1 minute before the procedure and 1 minute after the procedure. This was to count the amount of bacteria present. Some limitations. Some participants were reported to have washed hands under the recommended 15 to 30 second time limit, which would have been inadequate time for decontamination to be at an optimal level. Also, there was no suggestion in the article stating how they differentiated normal flora from infection-causing bacteria.
Hi, welcome back. I'll be reading study 2. This study was centered in 2 neonatal intensive care units in Manhattan, New York, which included 119 nurse participants. The participants were oriented to the study products and procedures. Also, a comparison was done on 2 hand hygiene products. They were antiseptic hand wash and an alcohol hand sanitizer. Both agents were used for 11 consecutive months. Both were alternated following random order. A 6-point scale was used to examine the hand at magnification ×3. A special technique known as the glove juice technique used for sampling was done to differentiate between normal flora and microbes. The outcome variable in the model was the presence or absence of any infection in each neonate. The sample size was adequate for the type of research being conducted, as there is a greater sample size fit for comparison. Limitations. In this study, there was no indication that hand washing procedure was performed within a 30-second time interval. Infections that were not yet diagnosed, that is, infection arising after study was conducted, may have gone undetected. Want you to know that hand washing is basic in preventing hospital-acquired infections, especially as relating to the hospital setting here in Jamaica. Also, research has shown that effective hand washing should be done for 15 to 30 seconds to prevent these infections. Okay? So always remember the antiseptic, antibacterial soap. Make a ladder. And as I said before, this should be done for 15 to 30 seconds. As student nurses coming into this profession should always, this may seem simple, but should always think of the importance of preventing the spread of infection for proper patient care and to limit the hospital stay for the patient. We don't want patients to come into the hospital and acquire infection that they out in the hospital. Okay? And dry your hands. Turn the pipe off and you discard. Thank you very much.